IBC Medical Services bring you Master's Certification Colposcopy & lower genital tract diseases.
Good morning, I'm Ken Lim. I'm a consultant gynae-oncologist in Cardiff, and I've been doing colposcopy for over 20 years.
My name is Robert Howells. I'm a consultant gynecological surgeon and oncologist and lead colposcopist based at the University Hospital of Wales, Cardiff.
I'm Dr. Aarti Sharma. I'm a gynae-oncologist in the University Hospital of Wales in Cardiff.
It's a very important subject. Women in the world suffer with cervical cancer, and colposcopy aims to reduce the incidence of cervical cancer through detection of early pre-invasive disease. The technique and the practice of colposcopy is based on very strong principles and guidelines.
Discuss briefly this morning on the management of glandular smears. This is a potentially difficult subject which wasn't actually in the remit originally of the UK screening programme. Glandular smears are quite rare and account for about 50 times less than squamous abnormalities when looking at referrals to a colposcopy clinic.
Spoken about during the course, which will be very useful to the candidates. We've gone through the basics of both cervical disease and vaginal disease and added lots of information regarding vulval disease. This course gives a lot of information on pre-invasive disease, but also on how to deal with all the areas surrounding it. We've talked about not just the disease management, but also about counseling patients, how to manage the patient as a whole, which I believe will help improve the knowledge for doctors, but also help them in their day-to-day practice when they deal with difficult situations. As we know, cervical cancer is unfortunately increasing in incidence and mortality in the developing world. This course will provide the basis needed for our doctors to apply the information that we've provided them and help them in their practice to hopefully decrease the mortality related to this serious cancer.
Often result in a procedure which would involve either preserving fertility or a hysterectomy. The options for treatment would include a two-stage LETS and or a cone biopsy or a hysterectomy. Prognosis from abnormal glandular smear is generally very good with good outcome. However, with conservative management there is a risk of recurrence. Hysterectomy is the best form of treatment for an abnormal glandular smear, and if someone has completed their family and doesn't wish to preserve their fertility, this is the best.
NHSCSP accredited colposcopist. This is at the start of his or her journey. We hope to be able to show good practices, samples, videos, as well as techniques for achieving colposcopy. And as we've run this course in Cardiff for many years with very good results, I'm sure that people on the course will be able to do the same.